it's Mickey with Motion Restoration. So in today's video, I'm going to be showing you how to massage someone who has a bunion. So first thing you're going to do is actually start off with doing a massage on the upper part of the leg, into the calves and into the shins. But for today's video, we're just going to be focusing on the foot. But if it's within your scope of practice, make sure you do the whole leg. All right, so get your client to lie face up, nice and comfortable. Grab yourself some coconut oil or a lotion with a good amount of glidability, and let's get started. So when we first start the massage, we're actually going to do a little bit of work with the myofascia, or the fascia of the foot. So in this case, we're actually going to be starting with no lotion on our hands and no lotion on our feet. So we can see the bunion is going to be on the first big toe, causing the toe to be pushed inwards. The main muscles involved in here actually form into the number 7. So it goes across from the 5th toe into the 1st toe and then down the base of the foot, as well as on the outside of the foot down here. So those are the main areas that we're going to be focusing on today. But first, we're going to be doing no lotion. So we're going to be starting on the outside of the toe here, and we're going to be pushing in. So as I'm just squeezing the foot in and I'm pulling it apart. And then I'm moving my way into the 4th toe and I'm pulling, so I'm pushing in as I'm spreading the toes apart. All the way through till we get into that big portion of the toe here. So this is going to be another insertion point, which is along the big toe, right in the meat here. So that is our origin and insertion of the oblique head for the adductor hallucis, and then we're going to work our way down the foot along the transverse portion of the adductor hallucis muscle. So just pressing in along the muscles, working our way. It's basically in the shape of a number 7, and then working our way back across into the 5th toe. Now, one thing you want to remember is everything is within your patient's tolerance of pain. Constantly checking in to make sure, is this okay? Is the pressure okay? How does this feel? It is going to be painful for a lot of people, so you may have to back off when doing movements. So again, we are on the adductor hallucis muscle, just pressing in. And then what we're going to do is when we get up to this big portion of the toe, we're going to go in between the 1st and 2nd toe in this type of a shape. And I am spreading the toes. And then I'm going to push in. So again, I am spreading, but then with my thumbs, I'm pushing inwards in between the 1st and 2nd toe. So press in and hold. Then you're going to work your way in between the 2nd and 3rd toe. Press in, spread, push, hold. Between the 3rd and 4th, press in, spread, and then work your way into the 4th and 5th. Like so, and then we're going to go into the transverse portion of this. So then what you're going to do is I've got supporting on the top at the front and back of the foot, and I'm going to be pushing with this thumb down as I pull up. So I'm spreading the muscle fascia. As I push up, I am pulling down on our adductor hallucis. And then we're going to work our way onto the side here. So this is the abductor hallucis muscle. So in this case, same thing. So we're going to be stabilizing at the top and pulling. I'm pulling the top of the foot this way as I'm pushing down this way. So we're pulling as we are stripping down the muscle. So do a few passes. Just like so. So you have now fascially warmed up the foot. Now it's time we can get into some lotion. So our main concentration is going to be on the bottom of the foot. So for this, we are just going to warm the foot up, just using the pads of our thumbs all the way up into the base of the big toe, into the second toe, the third, along into the fourth, and then into the fifth. And then trace again along the adductor into that big toe, and then trace down. And then the abductor. So you can even see when you start to push into the adductor, sorry, the abductor, you can even see the toe does start to move back into a normal position. So those are the main two muscles involved, but a good one to do as well is I want you to hold on to the big toe, and then what you're going to do is pull the big toe back into a normal alignment as you push along where the bunion is. So I'm pushing in with my thumb as I'm pulling the toe out, pushing down, so just going all along. Just like so. And then we also want to get into the joints of the toes as well. So you're going to grab onto the toe and we're just moving it back and forth. So I've got it in my hand and all I'm doing is moving the joint and I'm kind of forcing it a little bit more in towards the other foot. So we're just forcing it over. And then we're going to pull up, a nice twist, and then you're going to push the joint in, and again a nice twist. And then down. And then from this side, what we're going to do, so the same thing, we're trying to force the toe this way. So I'm going to be pushing on the outside where the bunion is, and on the inside, I'm going to be squeezing and forcing to go inwards. So as I squeeze, I am pushing up as I am massaging the foot down into the adductor, like so. So in between the first and second toe, squeeze up and then pressing on the inside down. Nice slow movements, go through a few passes. Just like so. And then at the very top, just below the base of where the toes insert into, I'm just putting my thumb and I'm just pressing along the top here. Just like so, all the way into the first toe. And then we're going to stretch the toes out as we push back into the adductor hallucis. So we're exposing the muscle a lot more. This can feel quite uncomfortable. Same thing, we're going to be drawing down and going lateral. So do a few passes like that. Just like so. All right, and then you can of course do movements that will make it a little bit more of a relaxing foot massage as well. So getting into the heel, getting into the arch, caving the foot in, splaying the foot out, just to help out the other muscles that are around as well. And then don't forget to do pulling of the joints as well. This always feels so nice. So just pulling on the toes. Just like so. And then of course at the end of every massage that we do, we flush everything up towards the heart. So that is just a very quick example of what you would do to help someone out who is suffering from bunions. Please go within the patient's pain tolerance. This can be a very uncomfortable condition that they are going through, but also you want to get in deep enough that it will affect the muscle. So if they're saying, I'm not really feeling much, it just feels nice and relaxing, you want to go a bit deeper, really get into the manipulation of those two muscles that I was talking about, the adductor hallucis and the abductor hallucis. Those are the main muscles that you want to focus on for the foot. I wish you the best of luck. If you have any questions or comments, please feel free to leave them. Don't forget to like and subscribe, and we'll see you in the next video.